Hello, welcome everyone to our third installment of the guidelines on acupuncture and moxibustion intervention for COVID-19 convalescence phase, to be presented by Dr. Maria Iressa Sulit. Let's give her a warm virtual applause.
Yay!
Virtual lang muna, Doc, ha?
Okay po.
Welcome, Doc.
Thank you.
Before we start, I would like to remind all participants naririnig niyo yun? Before we start, I would like to remind everyone to please put your audio on hold. Kasi if you put it on, even if though you're not talking or speaking, just in case there is a background noise that would interfere with our speaker. Then for the video, you can elect to put it on or put it off. But if you put it off, it could also help in our bandwidth. So i-observe na lang natin. If we think the reception is not that good, maybe we can help the bandwidth by turning off the video temporarily. Okay, then after the presentation of Dr. Sulit, we'll allocate a few minutes for questions if you have. Okay?
Okay.
Oh, okay. So I'll turn it over to Doktora. Welcome, Doktora.
Hello, good afternoon po. Naririnig niyo ba ako?
Yes.
Okay,
Loud
okay.
and clear.
Alright. So
Okay.
let's start. So I was tasked to discuss today the guidelines on acupuncture and moxibustion intervention for COVID-19 convalescence phase as recommended by the WFAS. Alright. So the guidelines of acupuncture should always be under the supervision of medical institution at all levels. So from level 1, yung diniscuss ni Dr. Ryan, the observation phase, the clinical intervention discussed by Dr. Tan Chong, and then this phase, we're in the convalescence phase or the resolution phase and the home care, it should always be under the supervision of medical institution. And then strictly implemented according to the requirements of quarantine and disinfection. Because as we know, COVID-19 is considered as an epidemic and it can potentially infect anyone regardless of age. Alright, so just a review. Hindi ko na to masyadong i-dig in because I think everyone knows this already. So if you do not have any symptoms, you do not have any exposure, no history of travel, when you present in the hospital, ang classification mo, hindi ka COVID case. Right? So, tinanggal na sa classification yung PUM or person under monitoring because all of us right now is already considered as PUM kasi meron na tayong community transmission. Alright, so when you have symptoms already and then you don't have a test yet or hindi pa lumalabas yung test mo, you're already considered as suspect. And then, if you have symptoms and the result turns out to be probable COVID or indeterminate, pwede kasing ganun yung lumabas sa result mo, ang tawag sa'yo is probable COVID. And then, if nakita dun sa RT-PCR test, sa swab test, ang result niya is RNA detected, you're already considered as confirmed COVID case. Okay? So, yung flow ng discussion natin today, medyo babaguhin ko lang ng konti. That's why I messaged yesterday or last night for us to review lang the pathophysiology. My discussion would mainly concern po on the principles and foundational background of why we use that point rather than what points to use. Kasi I would considered everyone here as medical practitioners. So we have to think in such a way that medical practitioners or clinicians should think. Okay? As doctors po, parang ganun din dapat yung line of thinking natin. whenever a patient comes to you, you have to know what the disease does to the body so that you will know and preempt what stage the patient is so that you will know how to deal with that. Kasi alam mo kung ano yung nasa na siya and then ano yung magiging reaction ng body towards it. So just to compare lang po briefly, sa Western perspective, COVID-19 is caused by SARS-CoV-2. Okay, it can infect lungs and or the intestinal epithelial cells. So if the virus attached to the cell, that's already considered as the infection phase. So during that phase, meron tayong ang treatment modality natin before that phase comes about is of course prevention. So nandun yung social distancing, hand washing, and everything else. And then when you are already infected with the virus already attached to the epithelial cells, the reaction of the cells is to produce chemokines or cytokines. Those are the defense mechanism of our body to protect itself from the infection or any pathogen. So that's already the acute inflammation phase. Pag nag-release na siya, and those chemicals can parang communicate with your immune cells. Okay? The immune cells are the ones that produce your antibodies, which fights directly the virus. If your body was able to produce enough antibodies and able to kill the virus, you will go into the resolution phase. But if your body is weak, you don't have enough antibody, or your infection is overwhelming, your body will try to produce more chemokines and cytokines to activate further your body to produce more antibody. So ang tawag doon, if overwhelming na yung inflammation, it will produce potentially cytokine storm syndrome. Yung cytokine storm syndrome is an overwhelming inflammation that your body is producing, and that supposedly a protective mechanism becomes danger to your own cells. Hence, you will have ARDS, sinisira na yung sarili mong lungs, you will undergo shock because there's overwhelming infection or inflammation, your kidney will go into failure, multi-organ failure na, your heart will also undergo myocarditis, something like that. And that's the disease, severe disease na. So in COVID-19, what we do not want is for the patients to undergo cytokine storm, because when that happens, masyado na pong mahirap tanggalin yung infection, and usually mortality na yan. Sobrang konti po yung nakaka-resolve dun sa stage na yon. So yung dyan na pumapasok yung mga convalescent plasma na naririnig natin, yung mga tocilizumab, yun yung mga treatment po sa medical side. So in our TCM perspective, we have to know so that we can target, di ba? TCM or acupuncture, we can use that in conjunction with the regular conventional treatment para mas maganda. Because ano ba yung concept natin? COVID-19 infects the lung and intestinal cells. So that's usually what? The metal element, right? The lungs and large intestine. So as we know, as we go back po, we have to review our TCM background, no? If a pathogen infects or attacks a specific element, di ba? Yung law of movement ng 5 elements natin, it can either promote, it can either attack, counteract, interact, di ba? Or overact a certain element. So in COVID-19 case po, the metal element is being attacked, the lungs primarily, which is the yin part, and a little bit po yung large intestine, which is the yang part. And what COVID-19 does is to enhance the counteractive mechanism of the metal element. So when you say counteractive mechanism, ano yung relationship niyan, pathologic relationship with the other element? If it's counteractive, the son now attacks the mother. The mother is the spleen and stomach. As we know, yung qi production natin comes from the lungs, right? Which is the kong qi, and then from the air that we breathe, and then yung stomach and spleen coming from the food that we eat, which is the gu qi. If you combine the kong qi and the gu qi, you will now produce the zong qi, correct? Yung zong qi natin, kung mahina po yung stomach and spleen, which is being attacked by the sun, yung metal element, ina-attack niya yung spleen and stomach, which is the earth element, the earth element cannot overcome the attack. Hence, mas lalong magdi-deplete po yung qi natin. So, however, if it's strong naman, it can overact the attack of the metal element, magkakaroon na tayo ng resolution. So, yung phase na yon, during that time, before pa mag-attack yung virus dun sa metal, yun yung diniscuss na mechanism during the medical observation phase. If you can remember, the ones discussed by Dr. Ryan, it will stimulate the qi, the function of the lungs, it will dispel and remove the pathogen, enhance the defense, diba? So, yun po yung basis kung bakit yun yung mga points na ginagamit during that phase of medical observation phase. If, for example, na-infect na sila, hindi na-overcome the stomach and spleen, the earth element, that's when the clinical phase comes in. Yun na po yung diniscuss before ni Dr. Tan Chochong, wherein the objective there is to stimulate your qi, the lung and the spleen. It will protect the viscera kasi yin element, as we all know, when you produce the qi, lahat ng organs involved there are yin organs, the zang organs, right? Kasi yung zong together with the yuan qi, diba? Which comes from your kidney, it will produce your zen qi, which then further becomes your yin qi, the nutritive qi, and the wei qi, which is your defense qi. Yung yin qi natin will then become the blood. Okay, so it goes down the line na po, na yung clinical phase, it will reinforce the earth and to produce metal and gold and stop the disease. And then, if you were able to control it, doon na papasok yung lecture ko, wherein we will enhance na the mechanism of resolution. Okay? So, kung hindi po na-control yung virus, since yung metal element na counteract niya na si earth, it will overact now the water, hence impair the kidney function. Furthermore, depleting your yuan qi. Or kung kunyari elderly yung patient, we can now explain why mas lalo silang susceptible with the virus kasi yung as we age, 'di ba, yung yuan qi natin, yung essence natin goes down. And then yung interaction ng metal to the liver and to enhance further and support the mother, the fire now element will also be activated. So everything else in the 5 elements comes into play if there is already severe infection. As related, kapag ganun din, hindi na control ng infection sa Western medicine, makikita natin na everything else becomes affected. Okay? So I hope naintindihan natin, ma-establish lang po natin na in every phase, we have to understand why we put that point rather than what point to use. No? So the role of acupuncture po in the treatment of COVID-19 is to stimulate the acupoints and directly smash the nidus to stimulate and strengthen the viscera and its qi so that the invading epidemic can be separated and expelled. Stimulate the qi while improving self-protection of the viscera to reduce the damage of the organs caused by epidemic. Kaya po siya dinivide into 3 phases: the medical observation, clinical phase, and convalescent phase. So the role of acupuncture came from the evidence from the literature, yung clinical and research, which incorporates now the previous improving lung function, regulating the innate immunity, improving the pro-inflammatory factors, activating the cholinergic and anti-inflammatory factor pathway, and regulating the system and overcoming the damage to the lungs. Okay? So objective po natin is to remove the virus, restore the vitality, and to repair the viscera such as lung and spleen. So the main points po is PC6. All right, as we review, PC6 will stimulate the yin, fire. Okay, so PC, diba, the fire element. So in order to stimulate po the earth element, we will need the help of the grandmother or its mother. Yung mother ng earth is the fire. Hence, we use PC6. So stomach 36, as we all know, is the main point to stimulate the body. CV12 is the front view of the stomach. Stomach 25 is the front view of the large intestine. And CV6 is the point of Zhang Qi exhaustion. So kung weak na yung constitution ng patient, we usually use the CV6. Alright, so that's the main point used in the convalescence phase. Right? If, for example, in your pattern weaving, you diagnose that the patient has deficiency of the qi of the lungs and spleen, your symptoms would be shortness of breath, fatigue, or appetite and vomiting, stomach distension, lack of force to defecate, loose stools, slight fat and white greasy coating yung tongue. So the main points, plus if you have obvious symptoms such as chest tightness, shortness of breath, you match that with CV17. Okay, CV17 will decongest your chest and it will allow the movement of qi in the upper jaw. Okay, so bladder 13, it's the back shoe of your lungs. Of course, you have to stimulate your lungs if you have shortness of breath. And then the lung one is where the spleen qi meets with the lung meridian. Okay, diba? The spleen qi has to connect with the lung qi in order to produce the zong qi. So kaya siya ang pinipiling point. Alright, so yan lang yung mga points. So for obvious naman po na symptoms, abdominal symptoms, you can add CV13 to control the abdominal signs and symptoms, the spleen 9, which is the HESI point used to counter flow qi and drain the dampness of the lower abdomen. Okay, so if in your diagnosis the deficiency of the qi and yin, there's deficiency of qi and yin, the symptoms would be weakness, dry mouth, thirst, palpitation, excessive sweating, poor appetite, low or no fever, dry cough with few, dry tongue with left saliva, weak pulse. So the main points for those will be the same: PC6, stomach 36, CV12, stomach 25, and CV6. And then for those with obvious weakness and shortness of breath, you will still add CV17 kasi nga it will allow the movement of qi in the upper jaw and control the shortness of breath. And then the CV8 is also used for general weakness, but please never put a needle on the CV8. The CV8 is located on your umbilicus, yung navel natin. So it's always moxa, okay? Because we don't want infection if you needle that part. And marami pong blood vessel doon sa area na yon, so we do not want to disrupt that. So moxa lang palagi yung CV8. Always remember po. And then for those with obvious palpitations, heart symptoms, of course, syempre, bladder 15, di ba? Because that's the back shoe of the heart. And bladder 14, back shoe of the pericardium. Makes sense, di ba? And then if patient has insomnia, syempre, heart 7, hintang, amnion, and then the kidney 1, which activates the brain energy. So, yung mga points na gagamitin natin, of course, will still depend on the symptomatology of the patient po. Then, for deficiency of the lung and spleen, and if there is stasis of phlegm blocking the meridian, manifested as chest tightness, shortness of breath, disinclination of speech, fatigue, sweating, cough, phlegm, dry skin, mental fatigue or poor appetite. The main point plus bladder 13, which is the back shoe of the lungs, bladder 20, which is the back shoe of the spleen, bladder 15, which is the back shoe of the heart, bladder 17, the shoe point of the diaphragm. Syempre, we wanted to enhance breathing. And then bladder 23, the back shoe of the kidney, lung 1, meeting point of the cheek ng spleen and stomach with the lung meridian, and CV17 also to decongest the chest. And then for those with phlegm, of course, diba, we all know that stomach 40 is the main point to expel the phlegm. And then the Dingchuan, it's the asthma point. It's a point to calm down the phlegm. Okay? So the guidelines po in choosing acupuncture only or moxibustion or combined, or lalagyan mo na auricular acupuncture, pediatric massage, acupressure is according to the situation. So those points are only guide for you para you know what to put, what point to put, but it still depends on how the patient presents to you at the time of consult. So hindi pwedeng dekahon yung treatment regimen natin. Same as sa medicine, hindi lahat, like for example, may patient na cough, anti-suppressant, cough suppressant. Maraming cough medicine. Bakit itong cough medicine na to ang ibibigay mo rather than the other? Ganon din sa atin. Lung meridian, why would you choose this point rather than the other points? Parang ganyan. Why would you stimulate? Why would you reduce? So we have to know the background. Para mas maganda po yung treatment and success. Mas makikita nyo yung success rather than symptom modification lang tayo or symptom reduction. Okay? Acupuncture shall be manipulated depending nga po kung kailangan nyo mag-reinforce or reduce. It should be left on each point for 20 to 30 minutes. For moxibustion, 10 to 15 minutes. Again, moxibustion, always pag sa CV8. Never needed. So, treatment should be applied once a day. Okay. So, before I proceed, meron pa po bang question or mamaya na tayo mag-question? Okay. So, I guess mamaya na lang yung questions. Alright. So, another topic po assigned to me is the safety precautions during pandemic of COVID-19. No? So, the sources I got this from is from WHO, CDC, DOH, and DOST. So COVID-19, as a review po, is an infectious disease caused by severe acute respiratory syndrome, coronavirus 2 or SARS-CoV-2. Coronavirus are family of viruses that may cause illness to animals and humans, particularly respiratory infections. So kamag-anak po niya yung MERS, which yung epidemic niya nangyari noong 2002, and then yung SARS, which happened between 2002 and 2004. Sorry, yung MERS pala is 2012. So the viruses are microscopic particles, smaller than bacteria, that has a capacity to live outside of a host body. So kailangan niya ng host. Ibig sabihin, kailangan niya ng something to live on para mabuhay siya. So, pathogen spread, so you can get the infection through ingestion, pag kinain mo, direct contact na hawakan mo, inhalation through respiratory droplet or airborne. Mamaya, i-further discuss ko what's the difference between respiratory droplet and airborne. So, ganito po yon, no? So if the infected individual cough out the virus, has a virus and coughs it out, or spit it out, or through speaking or sneezing, it will either produce a droplet nuclei. Yung droplet nuclei, it's very, very small particle. It's less than 5 micrometer in diameter. And it can just float in the air. Kaya siya airborne. Kasi nandyan lang siya sa air. Yung droplet, it's the virus or the particle, the infectious agent is inside the droplet. So nasa loob siya ng plema, nasa loob siya ng laway. So, mas malaki siya. It's more than 5 micrometer in diameter. So, pwede siyang direct contact through your hands when you sneeze like that, or when you touch your nose or your mouth. Or, it can drop into a surface and then mahawakan mo. That's a direct or indirect contact. Yung droplet naman, kapag malapit ka dun sa nag-sneeze or nag-talk, na-spit yung laway, tas napunta sa'yo, you are able to inhale the droplet. And kung airborne naman siya, sabi naka-float siya sa air, tas huminga ka, nakukuha mo rin yung virus through inhalation. Tapos, kung kunya, hindi ka nagugas ng kamay mo, tas kumain ka, you can ingest the virus. So, yun yung way of you getting the virus. No? So, survival po on surfaces of COVID-19, it usually stays in plastics and stainless steel for 72 hours, in a cupboard of less than 24 hours, in a copper surface of less than 4 hours. So a standard precaution, of course, is hand hygiene. We cannot emphasize that so much. Always sanitize your hands through soap and water or alcohol-based sanitizer, and respiratory hygiene. That's why you have to wear masks. And make sure that when you cough and sneeze, lumayo from other people. No? So hand hygiene, again, you have to do it for 20 seconds. So you wet your hands, you apply enough water and soap, and then you rub your hands palm to palm, and then over each other, and then across the fingers. And then each fingers, you have to do that rotationally. And then kasama po pati fingernails. Tapos saka po maghugas, and then you wipe. So again, just to differentiate po the droplet versus airborne. So droplet is inside the droplet. So the germs is inside po the laway or the plema that are coughed or sneezed. So yung safety precaution dyan is just mask. You can just use either cloth mask or surgical mask. For airborne, since naka-float siya and sobrang liit niya, when the person talks, the person just spits out the virus and the virus stays in the air. So ang mask po na kailangan dyan is N95. Okay? So there has been a contention between airborne or droplet contamination or spread po of COVID-19. As of now, still a respiratory droplet. Okay? It can only become airborne through a specific procedure. Okay? Ibig sabihin, magiging airborne lang siya kung na-aerosolize siya. So what are the things that would make COVID-19 airborne precaution, or how does it aerosolize? If, for example, you do nebulization, if, for example, yung patient na may COVID-19 nag-nebulize, yung nebulization will cause aerosolation of the virus. Hence, yung virus na nandyan, pwede na siyang maka-float sa air. Natanggal na siya dun sa plema, natanggal na siya dun sa laway. Another is if you intubate. Sabihin, kapag yung tubo, ipinasok po doon sa lungs, through the throat. Yon, aerosolizing procedure din yon. And then kapag ka po nag-suction ng secretion, sabihin kapag maraming plema, tapos sinaction siya, aerosolizing procedure din yon. So yung airborne po usually happens in the hospital. So whenever you are in the hospital, I would suggest that you wear N95. Kung hindi naman at wala naman po you reserve, please do not buy N95 anymore. Please reserve that N95 to the healthcare workers kasi nagkakaubusan na po. Maawa po tayo sa kanila kasi sila po yung mas maraming exposure at saka mas high risk po sila. So kailangan we will know how to protect ourselves, but also let's be fair, no? And then for us in general public, cloth mask, or for those who will be treating patients, acupuncturists, mas maganda siguro surgical mask yung gagamitin natin. Okay? Again, for aerosols, when you cough, ang travel niya is about 10 millimeters per second. So if just your regular inhalation, exhalation, about 1.5 meters lang yung matatawid ng virus or ng droplet. When you cough, it's about 2 meters. And then when you sneeze, it's about more than 6 meters. So kaya po kailangan, very, very important, kaya po, yan po yung basis kung bakit sinasabing social distancing. Hindi po yun basta gusto lang na mag-distance kayo. Meron po yung scientific explanation. Okay? So when, for example, the big picture here, yung may blue one is the patient without the disease, and yung maliit po na tao is the one who is infectious. So if it's about 2 meters or 6 feet, it can still travel. If the person sneezes or cough, it can travel within 6 feet or 2 meters. So if, for example, the patient has respiratory droplet, it's more than 10 micrometer, it can be stuck in your upper respiratory tract. Kaya po yung usual natin, kaya ang binibigay po nating testing, yan din po yung reason. Kasi dahil droplet siya, malaki po yung size niya, it will just get stuck in your nasopharyngeal area. Kaya po, ang testing natin sa kanya is oro, yung sa oral, and nasopharyngeal swab. Yun po yung binibigay nating testing and specimen para makita natin kung yung pasyente ay may infection of COVID-19. Kaya yun yung binibigay. If it's aerosol, ibig sabihin maliit, like TB virus is the best example of airborne bacteria. So it's very small that it can really go down to your lungs. It will not get stuck in your nasopharyngeal area. Diretso siya sa lungs. So if you can notice, ano ba yung binibigay natin? Specimen to check if you are infected with TB. Sputum, di ba? Yung dapat galing kung saan yung source niya. Plema, galing sa baga. So kailangan ilabas mo yan para mak-check natin. So, in order to prevent aerosol or airborne, we have to use N95 filter. Okay? So, just to differentiate po the masks to use, so N95 is, can potentially block small particles. Pero when you try to breathe on it, it's very difficult kasi sobrang tight niya in your nose. And yes, you can use it again. For surgical mask, medyo maluwag siya. Mas okay yung breath niya. Loose fitting, but please do not attempt to reuse surgical mask. Okay? It's not intended to be reused. Okay? Cloth mask or yung mga rewear masks, both breathable and also you can reuse it. So, bakit ko po ito dinidiscuss? There has been a study wherein they compared the surgical mask protection with the different types of materials. They compared that with a vacuum cleaner bag, dish towel, or yung tea bag, tea cloth na tinatawag natin, yung woven, okay, the cotton blend, the 100% cotton t-shirt, antimicrobial pillowcase, the scarf, pillowcase, linen, and silk. So, yung medyo malapit po sa protection is the vacuum cleaner bag and the dish towel. Okay? So, if you double the layer, kung dinoble mo siya, yung dish towel, nakadoble siya, yung tea-cloth, it can already mimic the protection of the surgical mask. Okay? So dahil nagkakaubusan na rin nga po tayo ng surgical mask, we can actually make use of a DIY mask. Just make sure that you will use the correct type of cloth. Okay? Yung tea cloth can protect us already. Or yung 100% cotton, it can already provide you with about 71% protection. Yung pillowcase, about 61%. Not so bad. If you maintain social distancing naman, I think that would already give you enough protection. By using dish towel, yung tea cloth type of cloth, cotton, pillowcase cloth. Okay? This is a study done by Van der Sand in 2007, wherein they compared in the left part, if you can see the particles that leak through the mask. If, for example, you want to protect yourself, the virus produces 100. So you can produce, the particles that can leak into the tea cloth is about only 33%. Okay? That's a homemade mask. Almost na same protection as the surgical mask. So if you still maintain social distancing and then wear tea cloth and surgical mask, that's already protection for you. No need na po to buy N95. But if you wanted to protect others, kunyari ikaw naman yung may COVID-19, ikaw naman yung may sakit, if you wear mask, just using tea cloth alone, no, it's not sufficient po to protect others because it can leak 90%. Okay? So if you wear mask, 90% of the virus can still go out. But if both of you are wearing mask, mas maliit na siya. Okay? So like this. So if both of you are not wearing mask and are always close to each other, you have a very high risk of probability to get the infection. If the person you're talking to has no mask and it's infected and you wear mask, the probability is still high. That is what. But if the person who has a mask and you do not have a mask, medium siya. If both of you wears mask, the probability is low. If both of you wear mask and you are far from each other, very low. But of course, if you do not have any exposure, kaya nga po paulit-ulit ang gobyerno, stay home kasi that will not give you any risk of exposure. Social distancing because it can decrease significantly the risk of exposure. And you wear mask, okay? So safety precaution in handling patients with COVID-19. In the general public, what you only need is face shield or goggles and mask. No need na for hair cap, no need na for gown, no need na for gloves, no need na po for shoe cover. Why face shield? I would say, actually, hindi yan masyadong really recommend, but I would personally recommend having face shield just because if you're wearing face shield, medyo yung unconscious touching of the face will be limited because of the shield. No? Kasi there has been a study na we usually touch our face about 50 to 100 times a day. So that's a lot of risk of having infection, especially if we do not always wash our hands or decontaminate our hands. No? In an OPD clinic, if for example you will be doing acupuncture, minimum protective equipment that you should have is face shield, mask, water-resistant protective gown, and gloves. Only single gloves. But if you will be going into hospital and treating severe cases of COVID-19, all of these you should have worn and the gloves should be doubled. Okay? Dalawang gloves po yan. Okay? So, how to wear masks safely? So, make sure po that you wash your hands or disinfect your hands. And then, make sure that the mask po is doesn't have a leak, no? Tapos, make sure that everything is working properly. So when you wear mask, you only touch this, no? So you touch po the earpiece and then you put it on your mouth and then strap it behind the ears. So para po ma-fix siya, you have to cover your nose and then pull it downward here. If you can notice, I did not even touch po the surface. Okay? And then, para lang ma-fix siya, with your finger, ganun nyo lang siya. Pitch nyo siya sa nose. And then that's it. Okay? Never touch po this part. Always, always pala, yung outer part po is the colored part. Kasi the colored part is the one that's giving us, that's the water repellent or resistant part. Kung 3-layer po siya, merong filter sa loob. And then the inner layer, the one here, yung white part, is the absorbent layer. Okay? So when you wear it like that, make sure you cover your nose and under your chin. Bakit kailangan naka-cover yung nose and mouth? Kasi yun po yung point of entry. Doon siya papasok yung virus. Kung nakaganito po kayo, yung virus pumasok na sa ilong nyo. Kung nakikipag-usap po kayo na nakaganyan at nasa chin po ninyo, wala na talagang protection. Ano lang siya? Palamuti. Okay? So when you take out naman po, make sure you also do not touch the front area. So you scoop it here from the back and then pull it downward and then discard. Okay? So never reuse surgical mask. Okay? So, hindi siya pwedeng hahawak-hawakan kasi nandun na yung virus. We usually assume that it is potentially infectious already. Okay? So, for the gown, you put on the gown, the mask, the respirator. Pakita ko na lang po siguro yung video. Sorry. So for inpatient naman po, this is how you do it. So usually po sa hospital, laging merong observer to check if you are doing the proper donning and doffing procedures. So if ever po you will be assigned in hospital, for example, matuloy po yung research of the COVID-19, this is what you will be expected to do.
Excuse me, Dr. Sulit. I think the video is not playing. What we can do, I think we can just have the participants watch it over by themselves with the link. Dr. Sulit.
Yes po.
It's not playing here.
Ano po?
Majority of the participants can't see the video.
Okay.
It's not playing actually. They just see the link. So what we can do is we'll just provide the link so
Sige
everybody
po.
can just watch it over YouTube.
Okay, okay. Sige po.
Okay. You can continue, Doc.
Okay. So, the best way po to avoid getting sick is, of course, to avoid exposure. So, prevention is better than cure. So, of course, avoid exposure, stay at home, social distancing, regular, frequent, proper hand washing. Yung disinfection po, for the surroundings, what is recommended by DOH is 0.5% sodium hypochlorite or yung bleach, and then 70% alcohol-based sanitizer for the hands. And prevention, of course, clean, cool, real food, adequate sunlight, adequate sleep, proper stress management. If, for example, the healthcare worker exposure in the management in the context of COVID-19, if you have been exposed and you are not wearing PPE, or you have a compromised PPE, you're already considered as high risk. So if you develop symptom, we test and then isolate. But if you have exposure and wearing correct PPE, you're considered low risk. If you develop symptoms, observe and then isolate also. Return to work. If you become symptomatic, you're not allowed. To. If you have symptom, you have exposure, and you are wearing correct PPE, basta may symptom, you're not allowed to work. Even if you do not have symptom, but you are not wearing the proper or correct PPE, and you have exposure, you're still also not allowed to work. You have to isolate yourself. If you do not have any symptom, even if you have an exposure and you are wearing the correct and proper PPE, you're still allowed to go to work. And then if you do not have symptom, no exposure, and of course, you're wearing proper PPE, you're allowed to work. So, yan na po yung end ng aking lecture.
Okay, thank you very much, Dr. Sulit. Before we go to a little question and answer portion, let us recognize the presence of our President, Dr. Tan Cho Chong. Good afternoon. Would you like to give a few words, Doc? Doc, you're on mute.
Mute ba?
Yeah, it's okay na. Okay na.
Okay, can you hear me? Can you hear me?
We can hear you.
Yeah,
Good
our
afternoon, Doc.
third of our lecture, no? So we to congratulate Dr. Sulit for a very enlightening lecture. Huh? So congratulations. No, Doctora is an internist, an intensivist. No? She's able to correlate TCM with the conventional Western medicine. I have a question for Dr. Sulit. Ano? Doctor, can you please comment on the use of ultraviolet? Ano? We have this big unit of ultraviolet, and we have the small, like a pen and a pen-like size, a ballpen size, a portable one. Can you please comment?
With regards po sa UV light, the minimum requirement, yes, it's the study has been good with regards to its use po. Just make sure that the minimum wavelength that you will use is about 250 nanometers. Because there is a lot of UV right now that only sells po mga 100, 160. That's not enough to cover and disinfect the surface. What you have to look into is the minimum requirement of 250 nanometers at least of UV light.
Good. Thank you. Thank
Okay, thank you, Dr. Tan.
Yeah.
Let's also recognize the presence of our secretary, Ms. Rochi Kagara. Ms. Rochi,
Yeah.
are you there? Ms. Rochi is located outside of the Metro Manila. I'm not sure if she has a good signal that she can speak right now. Anyway, let's also recognize the presence of Dr. Al Lagaya. Doc, would you like to? Are you still there, Doc? Oh, hold on.
Yes, Doctor.
Hi, Doc.
Hello.
How are
Here,
you?
I'm here.
Hello.
Yeah.
Would you like to give a few words?
Oh, ang ganda ng presentation ni Dr. Solit. I appreciate it.
Thank you po.
And for Dr. Kalchechong for organizing such a program.
Yeah. Oh, yeah.
May I also take this opportunity habang nakatapat na kayo sa akin. One of the concerns kasi sa mga merong face mask, they use it for 1 week. No?
Yeah.
Sa mga, lalo yung mga mahal, yung N95, na may kausap ko dati, hanggang kailan mo nang sinusuot yan? It was already 1 week ng araw-araw yung sinusuot. So nagiging useless na yung probability of protection kasi nako-contaminate. Ang advice ko na lang, please have something that is disposable and washable. And it was well presented ni Dr. Solit kanina. I-share ko na rin ngayon, while you are now focused on me, what I do, I get hold of a tissue paper, and of course, yung aking signature na face mask. And yung nga lang, this alone, if I'm going to light something, di-demo ko lang ha, pag ginamit ko lang yung cloth mask, yung sinabi ng doktora, if I'm going to light it, tapos I'll blow into it, patay agad siya. So, ibig sabihin, very porous, papasok lang talaga yung mikrobyo, baka makontaminate tayo. So, what I do, I double it with this tissue.
Supposed to be a filter. Yes. Very good. Yeah.
Yung actual na mask natin, yung surgical mask, is a 3-ply. Ibig sabihin,
Yes.
3 layers. The more ply, the better. Kaso hindi ka na makakahinga niyan.
Yes.
Ginamit ko, minsan naglalakad ako, hindi na ako makahinga. So, what I do, I use this, pag finold nyo ng isa, you now have a 2-ply. Dagdagan nyo to, it's a 3-ply. And I tested out with the light, hindi naman namamatay ng apoy, and I can still breathe. What I do, I use I use some kind of a rope or anything, kahit na rubber band. Ito, and then I'm going to put it inside. And so sa mga matipid na katulad ko, this one becomes more practical.
Yeah.
Yes, and then 2-ply na yan, plus this. It's already a 3-ply, and then if I'm going to light it with the test natin, I cannot flame take it off. So siguro it would satisfy sa mga nagtitipid sa atin na araw-araw naman mag-mask tayo. Just wear this para makatulong sa lahat. Yun lang po i-share ko sa magandang presentation ni Dr. Sulit.
Ang tawag po dyan ay lighter test. So,
Okay.
para rin po makita natin yung mga binibili nating fake na mask, yan din po yung ginagawa namin. Bago mag-order, pinapa-wear, tapos pinapa-blow. Kasi marami ngayon na fake. So, we have to be more careful. And very, very good po yung Thank you for sharing that. Kasi sobrang tipid niyan, sir. Mahal na ngayon yung mask. Ginto na siya.
Okay. Thank you very much, Dr. Lagaya, for sharing. Now we can go to our question and answer portion. Para hindi tayo medyo magkagulo, let us try to go one by one. You can either raise your hand or unmute your audio, and let's try kung sino mauna. If you hear somebody talking, then please hold on and wait for the other to finish muna. Thank you very much. Dr. Sulit, you can take over.
Yeah, sige po. Sino po ang may questions? Clarifications regarding po the lecture.
I'll also be observing at the side if I see anybody raising a hand. Okay, I see a hand being raised, Miss. Go ahead, Miss Malutinga. I guess baka napindot lang. Doc, we don't see any questions.
Okay.
So
mukhang I hope malinaw po yung yung
yeah, actually the
lecture.
lecture you presented today is very clear and very concise. Thank you very much, Dr. Sulit. Dr. Tan seems to be wanting to say something. Dr. Tan, go ahead.
Dr. Sulit, how many times do we do in a week the acupuncture?
Once a week, sir, based
Once a
on
week,
the
okay, once a week. Thank you.
for the convalescence.
Any other question from the participants? Oh, if there are no questions, what we will do here, a lot of participants a while ago were not able to see the video or hear the video. What we will do is we'll just ask for the link from Dr. Sulit and we'll just send it out to all participants of today. Okay.
Okay.
Dr. Sulit or Dr. Tan, would you like to say something?
Hello. So we like to thank Dr. Sulit, for a very, very nice lecture, and also thank you, Dr. Lagaya, for recommending our speaker, Dr. Sulit, to be our speaker today. And I think we have the next speaker will be Dr. Mike, Dr. Mike Vergara will be talking about practical home remedy, I think it will be June 8 ba? June 8, But by the way, June 5, I think Dr. Anday, will also give a talk, Am I right, lady?
Yes po,
June 5.
Andayan.
So please take note of the dates, June 5, Dr. Andaya. June 8, Doc Mike, also 2 p.m., And then how about si Rochi? Rochi will be June 15, She'll be talking about the back pain, low back pain. Am I right? And then, Leti?
Yes
Leti.
po. Doc,
Oh, yeah.
10 a.m. yung sa June 5.
June 5 is what? Friday, 10 a.m. ba? Oh, it's with you.
Opo.
10 a.m. So everybody, please take note of the announcement. Okay. Other things that we have done. Dr. Lagaya, Jackson.
So far, no more. Doc, would you like to make an announcement for the volunteer program if anybody would like to sign up?
Oh yes. Maybe among our audience, from PAAI. Can we have show of hands?
What Dr. Tan would like to say right now is this series of lectures are actually leading towards a research program. If approved, we would be needing volunteers, preferably our doctors here who would want to participate in the research program for treating COVID patients. So if any of you would be interested, I would want you to sign up with Leti. It's a intent sign up only right now. As we go along, as the research project becomes more clear, we'll be making more announcement. But as of now, we would just like to see kung we would have around how many participants, just in case. Thank you very much.
And of course, not only doctors, even CAA can join, Can join.
Okay.
Dr.
Okay,
Tan,
Dr. Lagay, I'd like
Dr.
to say
Tan.
something. Yes.
Yeah.
Yes.
As a update lang on the research,
Yes.
nagsubmit na si Dr. Tan Chong ng letter to DOH
Yes.
to identify ano yung venue na pwede natin paggawan. Kasi from there, doon natin malalaman ano yung mga adjacent hotels na doon magla-lodge yung ating during the quarantine period. And saka, pag meron na tayong budget na ganyan, Miss Ana Rojas is now computing everything para makita ano ba yung pwedeng honorarium na matatanggap natin. Kasi 3 weeks tayo, 3 or more, na mawalan tayo ng trabaho. So ano bang mga honorarium matatanggap dyan? As of now, we cannot proceed until we have the advice ng DOH sa anong venue. So please hold on lang kayo. Pag tama si Sir Jackson, pag kung sino may intent, hindi pa namang wala pa terms of reference na dapat na ginagawa pa namin ngayon ni Dr. John Villamayor, si Dr. Bok Andaya. We are working yet on the terms of reference. Pag meron na yan, siguradong dadami. Pero for now, we're not holding it against you. We just would like to have a number kung ilan ang interesado for that. Kasi kasama sa budgeting yan, saka sa computations, sa Gantt chart, ilan ang ilalagay namin per team. So for those who are interested, just submit your name to Dr. Tan Cho Chong and of course sa kanyang secretary at Skillet. Thank you, Dr. Tan Cho Chong.
Okay, thank you. Thank you, Dr. Lagaya. Okay.
Okay.
So,
If there would not be any more questions, any pahabol? Wala na? Dr. Sulit, would you like to add anything else?
Thank you po for the opportunity. And i-emphasize ko lang na as acupuncturist, mas maganda po na alam natin bakit natin ginagawa ito. So, yung background natin with TCM, kaya po yun yung basis and foundational. The way I presented my lecture is that way. Kasi I encourage everyone to think outside of the box. No? Hindi porket sinabi ng mentor natin na ito yung point for that, yun yung ibibigay mo. You have to know why you are using that point based on the principles that you have learned before you know. Kasi yung what point to use, madali yan eh. Pwede mo yung i-search eh. Alam mo yung kung anong number, spleen 6, stomach 36, or mga hindi masyadong ginagamit. You will know the point. You will know how to puncture it. But why you will use that kind of point is very important for a successful treatment in any kind of patient, not only COVID-19. You know.
Thank you, Dr. Sulit. I would like to double reiterate yung sinabi ni Doktora right now. Hindi ito dekahon. PCM is not supposed to be like that. And it's actually very, very wonderful that I heard from you today. Your presentation really correlated the TCM with the Western Med. And this would increase the chance of success. So please, everybody remember to do your diagnosis. It's not merely point usage. You have to remember how to diagnose, first and foremost. And second, what principles are you applying? The principles showed today by Dr. Sulit were based on the 5 elements. How about you? How is your treatment? Diba? So after knowing the principles, then you know what treatment prescription you will be applying. Okay? So if you don't have any questions, I would want to ask.
I have a question, please.
Okay, somebody's asking a question. Miss Cindy?
Good afternoon.
Yes, go
my
ahead.
question is pertaining to the research. I'd like to know if that will be conducted only in Luzon. How about here in Mindanao, specifically here at Lanao del Norte?
I think we'll ask Dr. Lagaya to answer that. Dr. Lagaya, if you may.
Okay, this is the first time that PAAI is applying for fund coming from the PTAC. So as much as we want it to become a nationwide thing, we need to pilot it in the nearest possible area. Saka isang venue lang, yung advice na hinihingi namin sa DOH. And so for now, ang nangyari kasi, no, nakikita natin yung emerging and re-emerging infectious diseases. Halimbawa, nakarinig na tayo ng dengue. Did acupuncture group already manage such thing? Wala kasi palagi tayong kinokontra ng ating mga kabaro wherein sasabihin nila what's the evidence base of using acupuncture for such. We can always quote journals, some of it is in Chinese, some of that is English, pero still palagi tayong kinokontra. Alam naman natin effective yan, which I'm going to ask Dr. Sulit mamaya kung how effective was her treatment to her patients with acupuncture, yung combined. Mamaya, Dr. Tanong ko lang. So from now, ang nangyayari, hold on muna tayo sa Mindanao, hold on muna tayo sa Visayas. Dito nga sa Metro Manila, sa Luzon, isang site lang ang inirequest namin. Saan ba yan? Yan ba yung sa World Trade Center? Yan ba yung sa Ninoy Aquino Stadium? Yan ba yung sa PICC? We still don't know. We need the advice coming from the DOH. So the letter by Dr. Tan Chio Chong needs to be followed up by Letty every day para mapapadali yung ating project proposal. So that's one. Ano po. Ang nakikita ko rin, yung may nagke-question dito about the PP and everything. Yung complete PP ang paggagawa natin kasi although parang inpatient na ang dating niya, pinakita ng Dr. Sulit, sort of naka-PPE talaga lahat tayo, and then the team leader will see kung tama ang procedure. Yan, mga details yan will follow in the succeeding days to come. Please pray na maaprubahan at dumating agad yung mga nire-request namin ni Dr. Tan Chio Chong sa DOH yung mga advices na ganyan. Please pray for it. And of course, we also need prayers every day para sa magkaroon tayong divine shielding, lalo na si Dr. Sulit, frontliner yan sa ICU, pinakadelikado yan. Ang mga, there was even a group na I participated, ang high risk daw sa mga participants are the aesthetic doctors. Kasi they're working on the face, tapos nakabuga yung pasyente sa kanila, followed by the dentist, followed by the anesthesiologist. Kasabay na rin yan yung mga ENT, saka sa mga opta, mga direct facial, ano yan. So, if you're really serious in treating the patients come the opening of your clinic, follow what Dr. Sulit already made mention on how to protect yourself. Malaking bagay po yan. Okay. Dr. Sulit, I came in late eh. Ayaw ko kung nasabi mo na, you are applying acupuncture to your patients sa hospital mo. Kumusta ang response? Kasi ang research natin is just looking at the symptoms. Nag-improve kasi by parameters, yung duration, umiksi ba yung coughing, umiksi ba yung fever, umiksi ba yung mga dyspnea, yung mga ganun ang parameters natin. Sa tingin mo, doktor, sa mga pasyente mo applying acupuncture, may testimonial from a doctor applying it, can you say na may effect sa mga pasyente mo?
It does, significantly. Actually, when I started this way back in 2000, I started learning acupuncture 2017. So I incorporated that practice mainly 2018 na. So that's a whole year. Since 2018, in the outpatient clinic alone, I have not admitted any hypertensive urgency anymore. Okay? So, nakokomentan ako lagi ng nurses ko kapag mataas yung BP tumating sa akin sa clinic, 200, 180. Usually, ang binibigay dyan, di ba, clonidine, yung under the tongue. So, usually, nagbibigay ako isang dose lang. Kapag hindi bumaba, kinakausap ko na yung pasyente sa ER, and then nagpapaalam ako kung gusto niyang mag-acupuncture. Usually naman, pumapayag. So, I do acupuncture, and then I just bleed yung apex. After 30 minutes, bumababa na siya 150, 140. Uwi si pasyente. Wala akong admission. So, yun po yung mas mabilis, no? Na significantly talagang control of diabetes also, but not so much. Kailangan doon medyo mas maraming treatment. Pain, very, very good. If, for example, amendable yung patient, usually during the outpatient clinic, nawawala na yung pain nila. No need na to buy pain meds. Especially for patients na high risks. Usually yun po yung pinipilit ko talaga. Yung mga hypertensive na, diabetic, naka-aspirin, tapos magbibigay ka pa ng, pain meds. So usually, I really recommend and encourage them to try acupuncture. Minsan sinasabi ko nga, sige, pag hindi nawala yung pain, wag mo akong bayaran. Tapos parang fingers crossed, oh my God, sana bayaran niya ako. Pero binabayaran naman nila ako. Kasi paglabas nila, significantly decrease na yung pain nila. So yun, kaya sila.
Okay. Dr. Sulit, lulubusin ko na ang susulit na namin ang kabutihan mo, kabaitan mo. Kasi alam na natin, part of the research is review of literature o kaya quoting a study kahit na case study o case series. Is it okay for you, yung sabi mo ngayon, how effective this for COVID patients, kahit na just text it to Dr. Tan Chuchong, a figure of ilang percent ang mga pasyente mo na umiksi ang duration ng symptoms nila at yun na magiging babasihan natin pag gumawa na tayo ng paper na ilalabas natin dito for proposal. Kasi,
symptoms po of ano?
Yes.
Of whatever
symptoms of COVID. No, of COVID lang. Symptoms of COVID.
Yung COVID po kasi, medyo mahirap ata kasi hindi ako yung attending. So, hospitalist lang ako doon. I don't do acupuncture on those patients specifically.
Baka during the time na inaaprubahan tong ating proposal, baka makagawa ka na, kahit na case study lang, kahit isa lang yan, o case series, mas maganda, and then send it to Dr. Tan Chuchong. We will quote you as part of the preliminary study why we are pushing this research.
Sige sir, kung may pumayag po na pasyente.
Okay, papirmahin mo lang for consent. Yes.
At
And attending, correct.
Sige sir.
Yeah. One of the concern namin, Dr. Tan Chuchong, is we are pushing for acupuncture, as all of us are doing, dito sa universal healthcare. At alam natin, prevention is better than cure. Gas na statement yan. And we know that acupuncture can do a lot of prevention. Bago ma-confine sa ICU, ang isang pasyente at gagastos siya sa milyon, sa 8 million ba yung gagastos ng isang politician na ganyan, what if mapagaling natin habang nandun pa lang siya sa studies? At pag maganda ang research natin, makikilala tayo that we all of us as acupuncturists has a role in this universal healthcare. Yung ginagawa namin ng PAAI through Dr. Tan Chuchong.
May I ask something, and Dr. De La Paz, are you done, Dr. Lagaya?
Yes po.
Yes. May I ask something? If you look in the chat page, ang dami ng questions doon. So, pwedeng pag-isagot nyo. Yung aking tanong ay, what kind of PPE should an acupuncturist do for the two situations? One, your patient has unknown COVID status. Yung mga walk-in, di mo kilala yan. Basta unknown COVID status. Number two, known COVID positive. What kind of PPE should the health worker acupuncturist wear? Thank you. I'm over. Please answer.
Okay, so yung PPE po for unknown or confirmed COVID, ang minimum requirement po in an outpatient clinic is to protect po the respiratory droplet. So face shield, mask na surgical, water repellent gown, and single gloves. Okay, so that's the minimum requirement. The gloves should be changed every after procedure. The face shield should be washed with soap and water. Hindi po alcohol kasi pag alcohol nasusunog yung face shield. Nagbibitak-bitak siya, so pumapangit. So soap and water, basic po tayo, yun pa rin. And then you wipe it clean. For confirmed positive, depende po yan if you will be doing aerosolizing procedure, you would have to wear N95 and a cap and a shoe cover on top of the mask and the face shield and the gown, and you have to use double gloves para kang nasa hospital setting. Pero kung for regular protection, just the minimum po na face shield that you have to disinfect every after patient. The mask po, no need na to change every after patient kasi meron ka namang face shield. Not unless it is visibly soiled, then you have to change. Otherwise, just maintain it during the 8-hour shift. That's already protective. And never reuse. Once the 8-hour shift is done, you have to discard the surgical mask and wear another. Yung gown po, water repellent gown, and then ideally you have to change every patient. Kung hindi kaya at masyadong magastos, you can just use after the patient po, you can just use steam or UV light para ma-disinfect po yung harap. and disinfect every after patient. Kasi you wouldn't know that this patient has COVID or is infected, and then you transfer into the next patient. Kung same po yung PPE na gamit natin, you will do cross-contamination. So, at this point, medyo magastos po talaga tayo sa clinic kasi every after patient, bago-wash ka, i-disinfect mo yung gamit mo, mag-change ka ng gloves, hindi pwedeng ulitin. So, yun po. Nasagot ko po ba yung tanong?
Oo, nasagot, pero may mga tanong na, like, how do you do acupuncture with the gloves on? Why not na lang with your bare hands and then wash hands after? Over.
Pwede rin naman po yun. Pwede rin naman po yun. Kaso, yung risk nyo po for contamination, medyo mas mataas.
Okay, but sige, thank you.
Okay po.
Okay. Thank you,
Para po
Dr.
medyo
Sulit.
mas comfortable, you have to wear a gloves that's really fitted in your hands. Kasi kung maluwag po yung gloves, mararamdaman nyo po yung parang, hindi nyo siya makakapa. Pero if it's fitted just the right size sa kamay nyo, para lang din, yung feel po niya, para lang din halos kamay mo. Parang ganon. So you can really still perform the right acupuncture. So the size of gloves really have to fit the person wearing it.
Okay, Dr. Sulit, there's another question here. Do you have any suggestion kung mag-open na ang acupuncture clinic? What is your recommendation for the protection of clinicians and patients?
For the protection of the clinicians po, yun nga po, minimum required. Kung ano lang, face shield, face mask, if you will be doing procedure na, naka-gown, ideally naka-gloves. Kung hindi po comfortable with the gloves, you can get away with it. Just make sure to wash your hands with soap and water. Alcohol alone, I do not suggest. Kasi mas mataas po yung protection kapag hinugasan yung kamay. May studies po that has established the difference of washing hands with soap and water for 20 minutes versus alcohol-based and not washing. So, or alcohol-gel. So, mas mababa yung alcohol-gel. Medyo mas mataas yung alcohol-based na 70% na water. Na fluid, and pinakamataas po 99% po kapag soap and water using the proper technique, no? So palm to palm, hand over, fingers intercrossed, each fingers ganyan, tapos your nails, and then you wash. Yun po. For the patients, I would still suggest that all of them should wear masks. Because again, if you go back to my lecture, if both of you are wearing mask and has significant distance, very low na siya. Kahit malapit kayo, both of you are wearing mask, low pa rin siya. So the probability of getting infected really goes down the higher the PPE requirement, or at least mask man lang sa lahat ng pasyente ninyo. Kahit cloth mask. Or sabihin nyo na lang, yung cloth mask, mas maganda yung T-cloth. Yung ginagamit po sa yung woven type.
Okay, thank you very much. There's another question. Dapat po ba latex PVC?
Hindi naman. Hindi naman.
Thank you.
Okay. Please be reminded that based on our government's requirement, we are not supposed to treat COVID patients outside hospital setting.
Yes.
So you are taking tremendous risk if you know that the patient is COVID positive. It's not just a risk against the clinicians, but it's also against the other patients visiting your clinic. So please be aware. If it's you're putting on the protective equipment because you don't know who are infected, but if you know who are infected and you recognize that the clinic is not equipped to handle COVID positive patients, please refer to hospital. Thank you.
Yes. I-reiterate ko rin po na kasama yung first part po ng lecture, if you would review all levels of treatment ng acupuncture of COVID-19 should be under the supervision of medical institutions. So, ibig sabihin, it has to be an umbrella. Hindi po pwede magtitreat ka ng walang conventional treatment. And usually, for COVID-19 patients, they're actually housed on a specific area. Somebody's looking after them. If they are already symptomatic, it has to be admitted in the hospital because aside from the acupuncture, they really need po conventional treatment also. Kasi baka po hindi yan makahinga, kailangan talaga nilang intubate. Yun po kasi yung mahirap sa COVID-19. Hindi natin siya mape-predict. Ang usual course po niyan, 1-day fever, 2-day fever, nahirapan huminga, pagdating sa ER, naka-nasal cannula lang. After 3 hours, naka-high flow na yan. Biglang, on the 6th hour, 7th hour, 8th hour, tutubuhan nyo na yan eh. So, ganun po siya kabilis talaga. So, kung hindi natin siya maaagapan, mas maganda talaga, yung kung COVID-19 confirmed yung pasyente, wag na lang muna nating tanggapin. Or dapat sigurado po na yung ano nyo, clinic nyo merong negative air pressure. So, tapos well ventilated. Kung magi-aircon, dapat nakabukas yung bintana. Nakabukas yung door. Kasi you don't want a confined space. Ganun po siya. So, pag nag-open tayo ng clinic, medyo magastos po talaga ngayon. Kasi kahit naka-aircon ka, kailangan may ventilation pa din.
Yeah. Thank you very much, Dr. Sulit. Okay. Do we have other participants who wants to ask a question? Okay, we have hands being raised, Miss Malutinga.
Ako ulit. Good afternoon po.
Good afternoon.
Sir, itatanong ko lang sana, how about the yung mga bed sheets? Kinakailangan ba siya every time natatayo ang patient, papalitan ulit yung mga bed sheets na yan?
Yeah.
Like din yung mga curtain po natin, kung magkakadikit, ano yung mas recommended na kurtina na gagamitin? And then the same time, yung spacing din ba ng bed dapat ng patient is 3 meters away dun sa next patient? Parang gano'n. What do you think po, Doktora? What is your suggestion? How about that?
Yun pong bed sheet, yes, you have to change it. Kung masyadong magastos, i-disinfect nyo siya. Make sure to disinfect with steam or UV light na 250 at least na nanometer. Na 10 beses mo siyang gaganunin. Tapos you just let it stay for 15 minutes at least bago mo lagyan ng another patient. Kasi po yung UV light, kapag po na-expose yung pasyente dyan, yung skin ng pasyente, baka mamaya, akala mo tinitreat mo siya, tapos biglang magka-skin reaction, akala niya galing sa acupuncture mo, yung pala galing sa UV light mo. So, isa po yon. Kaya yung interval po of each patient, medyo kailangan space din sila. Kung meron po kayong tawag nito, curtain, I would suggest na yung curtain natin, water repellent. Yung kahit na umubo sila, hindi Tapos yun, i-disinfect din talaga yung space po. With steam or UV light. Or pwede po kayong magkaroon ng HEPA filter sa loob ng clinic para at least, yun nga po. Magastos po talaga siya, HEPA filter o di kaya negative air pressure. Otherwise, yung minimum requirement natin is just fully ventilated na area. Tapos, yun, isi-steam mo lang siya or UV light every after palit.
So, doktora, hindi din niyo ma-recommend kung yung mga pillow natin is made in cotton. More on, dapat ang surface niya is parang
water repellent. Kasi ang po dyan, ang basis dyan, bakit ganun? Kasi kung cotton, nag-absorb siya doon. Diba? Kung water repellent, since, babalik tayo sa basic, no? virus po na COVID-19, it's a droplet. So, ibig sabihin, the virus is inside the laway or the plema. Since fluid siya, kung kunyari nag-spit out dun yung pasyente at water repellent siya or water resistant, magsa-slide down lang siya. Hindi siya didikit doon sa area mo. So, pag nilinis mo siya, mas madali. Pero kung kunyari cotton po siya, tapos nag-stick siya doon, pwede kasing pag lumabas na yung, kapag nag-disintegrate yung saliva, lumabas yung virus, nakadikit na siya doon sa doon sa surface mo. So, mas mahirap po siyang linisin. Parang ganun lang. Kaya po sinasabing water repellent kasi para magsa-slide down lang yung virus doon. Hindi siya didikit agad. And mas madali yung paglinis.
Okay po. Thank you, Doktora.
Welcome.
May I ask something? I'm Dr. De La Paz. Ma'am, if we apply the basics, hindi ba pag ang virus ay nagpunta sa cotton, hindi naman siya mag-live there forever. If it does not find the host, it will be dysfunctional in, I think, 1 to 2 days. So, pwede ba kung if we cannot afford UV light or steam, just collect all those and then hang it outside in the sunshine, let it be for 1 to 2 days and then recycle it. Pwede bang ganun? I mean, you know, where we cannot afford, all of us cannot afford UV light and steam.
So, ano po, palit. Every patient po, palit. Tapos, bleach. Ang panglinis po natin is bleach. And then, sunlight. Yun po.
Hindi ba pwede sunlight lang? Kasi ang bleach, another set of gastos na naman yan. Labor pa.
Kasi for ano po, yun po yung minimum disinfection natin, ma'am na proven po to disinfect. Aside from soap and water, that's the additional disinfection of the surface and surrounding. That has a study na talagang nakakatanggal po nung virus.
Sige, thank you. How I wish we could come up with a list na from the most cost-effective and then hanggang sa tumaas ng tumaas, high-tech na high-tech and then mas mahal na. So you can see where you can afford. Ang pinaka-lowest would be bleach and then sunlight and then next would be UV light and whatever. Sana may ganyan na listahan. Thank you.
Dr. Tan?
Yeah, like that. By the way, si Doctora, can you hear me? Can you hear me?
Yes.
Yeah.
Doctora De La Paz is an obstetrics gynecologist. She's also a certified acupuncturist. Okay, that I think you raised very important practical points. The economical ways to disinfect. These are very practical points because we cannot afford to be practicing in the hospital with all those expensive gloves, PPE, etc., etc. Okay, so those are very practical, economical points of Dr. De La Paz.
Thank you.
If I may add, with regards to being economical, the most economical way of sanitizing is still soap and water.
Yeah.
After that, exposure to the sun. Remember, the virus is very susceptible to soap because of its lipid skin. So soap is still the best. And that's, I think, the most economical right now.
Very practical.
Yeah. But it would be advisable, especially if you know there's somebody positive, you have to use bleach. Yeah, that's the minimum requirement. Thank you. Dr.
Thank you,
Sulit?
Jackson.
Yeah.
Yes po.
Okay. Dr. Sulit, would you like to add something else?
Okay na po.
I think everyone's questions are satisfied for now. But please, because of the series of questions, this comes into mind. As acupuncturists, be very careful. We are not endorsing that you go treat positive COVID patients right now. The information you have right now, I think it would best serve us if you can look after first yourself and your loved ones. Then make sure you prepare your train of thoughts. Then later on, if you want to try to treat COVID patients, maybe you can volunteer and join the program and be under supervision. Treating COVID positive patients is no joke. And it's very risky, as we can see how many health workers were already affected and lost lives. So please, everybody, please take care. This is not an endorsement, but additional knowledge in preparation for our research project. Thank you. Anybody would want to add anything else before we close? Dr. Tan?
No
Dr.
more.
Lagaya?
Thank you to
Dr.
Doc Al,
Sulit?
Dr. Sulit.
May
Dr. Sulit,
question lang po
Okay.
dito ng percentage po ng bleach, 0.5% po.
Okay, 0.5% for bleach. Okay, let me add something else. Once we're talking about bleach, you have to make sure the bleach is new. 0.5% is relative to the strength of the bleach you have. Normal is 0.5, pero habang tumatagal yan, once you open it, every month it degrades. And if you make a mixture of bleach with water, you should use that mixture within the 24 hours. You cannot stock it. So don't go hoarding bleach then. You only buy what you can use. And you mix, when you mix the bleach, you use it for the next 24 hours. You don't mix everything. Bleach dissipates, its efficacy dissipates with exposure to light also. Okay? Thank you very much.
I have another question. Pwede hirit?
Sige po.
What
Doc.
happens to the advice to the patients who we tell, do not wash your hands, do not take a bath until tomorrow? Part of COVID preparedness is frequent hand washing. What happens kung kaka-acue lang niya today, tomorrow pa siya maka-hand wash?
No, actually, Doc, normally we recommend patients to not wash for at least a minimum of 2 hours just to allow the pores to close. Since the patient would be leaving na rin naman, it might be good for us to advise them not to touch their face, their mouth, their nose, their eyes during this period that they haven't washed.
Okay. So it's clear. 2 hours, not tomorrow.
Yeah, not tomorrow. Actually, we just allow the pores to close.
Okay, thank you.
Thank you, Doc. Okay, thank you very much, Dr. Sulit. We actually had a very wonderful time and very wonderful lecture today. It's an honor for us to be having you today for our number 3 in a series of lectures for the WFAS guidelines.
Okay. So we'll see on June 5, June 5, 10 a.m.? 10 a.m. ba?
Yeah, we'll see you all again on June 5.
June 5. Okay. Thank you.
Okay, thank you.
Thank you for joining this series of lecture by PAAI.
Bye-bye.
Thank you.
Thank you very much. Thank you, everybody.
Thank you, Jackson. Thank you. Bye-bye. Doc Al. Dr. Sulit. Bye-bye.
Bye-bye.
Salamat.
Bye-bye.
Thank you.
Bye-bye. Thank you.